Welcome back. I mentioned at the beginning of the show that you might have headaches or facial pain, and you might have trigeminal neuralgia. Well, here to help us answer that question is Dr. Christopher Spears, who is a neurosurgeon with the Lexington Clinic. Welcome.
Thanks for having me.
Now, use the term trigeminal neuralgia. Most of the people watching out there have no idea what that means. So give us an idea of what that is.
Sure. Trigeminal neuralgia is a chronic, it's a very painful condition that can cause severe shock-like, really electrocuting pains in the face. It's typically on one side of the face. It's usually the lower half of the face on one side, but it really can affect any part of the face, around the eye, the forehead. It can affect the teeth and gums as well. And actually, some people are unfortunately misdiagnosed with dental problems, and some of them have dental procedures done, which unfortunately don't work for this problem. But the pain is often very severe, and many people who have this condition describe it as the worst pain in their lives.
Now, I mentioned trigeminal nerve, so it's actually a nerve that's a pain, but describe that. Where you heard sciatic nerves down your leg, and trigeminal nerves in your face?
Right. So the trigeminal nerve is a nerve that sends all of the signals from your face, the sensation in your face, to your brain. It's broken up into three parts: the top part, the middle part of the face, and the lower part. It's usually the lower part that's affected.
So if you get trigeminal neuralgia, what causes it?
So there are several causes. So the nerves have a natural insulation around them called myelin, and that just helps them send signals throughout the body and the brain more effectively. And any condition that can cause damage to that myelin can cause abnormal signals through the nerves, and that your body often perceives that as pain. So less commonly, you can have diseases that cause problems with the myelin, like multiple sclerosis. Those are called demyelinating diseases. Or there can be a tumor inside the head pushing on the nerve that can damage that myelin as well. But the most common cause for trigeminal neuralgia is actually a blood vessel that's normally in your brain, but it gets too close to that nerve and starts pushing on it, and that causes damage to that myelin.
So how do you treat it?
The first line treatment for trigeminal neuralgia are medications. There are a few options for medicines. The most effective medicines are actually anti-seizure medicines, something like carbamazepine or oxcarbazepine. They tend to be very effective. Unfortunately, they can have some side effects. They can lower salt levels in your blood. So if you have this condition or you're on that medication, your family doctor often checks your salt levels in your blood. And most people with trigeminal neuralgia do respond to these medicines. It's actually a clue that that's actually what's going on. Unfortunately, about 10% of people or so continue to have significant pain with medicines. And in those people, that's when we start talking about doing more invasive procedures.
And you mentioned invasive procedure. You're a neurosurgeon and you do that procedure.
Right.
So tell us what it is and what you do.
Sure. So the procedures are broken up into two different categories: destructive or ablative procedures, and non-destructive or physiologic procedures. I often tell people this is kind of like finding a fire ant on your foot that's stinging you. And the destructive procedures are, instead of taking the fire ant off your foot, you damage the nerve that sends the pain signals up your leg. Whereas the non-destructive or the physiologic procedure is taking the fire ant off. Both give the desired effect of lowering the pain, but in different ways. The destructive procedures are things like radiation therapy, where you can radiate the nerve, or there are smaller procedures where you actually put in a catheter or a needle close to the nerve that sends the pain signals from the face and damage it in a controlled way. And it does cause some numbness, but it can decrease the pain as well. The physiologic procedure or non-destructive procedure is the gold standard and most effective and most durable treatment option, and that's the surgery, microvascular decompression, or MVD. It's the most invasive procedure, but it is the most effective. And the idea behind that procedure is you take the fire ant off. That's when a neurosurgeon goes to where that nerve is through an incision behind the ear and gently takes the blood vessel off of the nerve and puts a cushion between the nerve and the blood vessel to protect the nerve.
Well, that's great information. We appreciate you what you do, and again, appreciate the care you give to the patients.
Of course.
Thank you for coming in and tell us about it. And if you have trigeminal neuralgia and you failed medications, a neurosurgeon might be able to help you. We'll be right back.